Hi, Kurt. How are you?
I'm great, thank you. How are you today?
Good. So thanks for coming in and agreeing to demonstrate some musculoskeletal exam findings. Often when patients are on the other end of a screen, they can use their own body to examine themselves and get an idea for the provider what's going on with their injuries. If you're ready to get started, we're going to start with your wrist.
Okay.
So wrist pain is often from a fall or from overuse. So when you fall onto an outstretched hand, sometimes we need to assess the wrist for fracture to see if there's a need for an x-ray. So I want you to just hold your hand out so I can see your wrist, and I want you to flex and extend the wrist. Good. Now I want you to go from side to side. Very good. And now can you go from side to side? Good. Any pain there with motion?
None whatsoever.
Now I want you to take your thumb. I'm going to turn my hand to the side and pull my thumb out. I want you to be able to see. Do you see this little divot right here? Okay. Yep, that's your anatomical snuff box. So I want you to take the thumb of your opposite hand, put it right there on the divot, and go back and forth to see if you have any pain or tenderness right there. We're basically checking for a scaphoid fracture. And okay, so now I want you to examine this part of your wrist. So I'm going to have you turn your hand face up, and I just want you to take your thumb and just feel across those bones in the front of your wrist, but you can hold it like this so that you can get a better feel. And no pain there when you're palpating.
Okay.
Good. So that's part of the exam for falling on an outstretched hand. So now I want to go to some overuse injuries. The most common ones are de Quervain's tenosynovitis and carpal tunnel syndrome. So we're going to start with carpal tunnel. So I want you to take your hand, palm up like this, and then hyperextend it just a little bit. Then with your other hand, you're going to tap right here on your carpal tunnel. That's where the median nerve goes right here up into the hand. So flex like that. Good. And now tap. Okay. Are you feeling any numbness or tingling anywhere in your hand with that?
No.
All right. Now I want you to put your hands together in a prayer sign. Go to reverse prayer sign. And I want you to try to get the back of your hands straight across each other. And you're going to hold them here like this. This is called the Phelan's test. And you're going to hold them for 30 seconds. All right. And let me know if you have any numbness or tingling in the next 30 seconds. You should be feeling some numbness or tingling in your hands or fingers if you have carpal tunnel. The other overuse injury that we get in the wrist is de Quervain's tenosynovitis. And that is this part of the wrist right there. We see it in new mothers when they're holding their babies' heads. We see it in people who type a lot. So what I want you to do is I want you to take your thumb, tuck it in, and make a fist. And then you're going to extend, hyperextend that wrist just a little bit, and you should be feeling some pain right here on the top of the wrist. So I want you to feel right there, and tell me if you're...
Turning the wrist up?
Nope. Keep your wrist, yep, and then just let me show you from sideways so you can see it. You're wanting to hyperextend it a little. So with de Quervain's tenosynovitis, you will feel pain right here on the top of your wrist.
Oh, okay, there. Got it. No pain.
Good. So that's the hand and wrist exam. So now let's go to the neck. If you have a cervical radiculopathy, often what happens is the nerves get pinched in the neck, and that can cause pain radiating down the side of the neck, down into the arm, and it can be sharp stabbing pain, and it can lead to areas of numbness and tingling in the upper extremity. So what I want you to do is I want you to pretend like you're having the pain in your left or right shoulder. This is a 3-step test, so I want you to watch me do it first, and then I'm going to have you do it. So if the pain is going down your left arm, what you're going to do is you're going to turn your head so that your chin's towards your left shoulder. You're going to tilt the chin up, so head back a little bit. You're going to take your other hand, put it right here on top of the head, and press. Okay, now let me see you do it.
Turn, tilt, push down.
Very good. All right, so that is a modified Sperling's maneuver. And if you were to have a cervical radiculopathy, doing that will cause the pain. It will reproduce the pain in your arm. Now let's go ahead and move on to the shoulder exam. When you are examining the shoulder, pain without weakness is a sign of a tendinopathy, and this usually does not require any imaging. But pain with weakness usually indicates a tear of a tendon of the shoulder, and that might mean that you need to get an MRI of the shoulder. So what I want you to do is just sort of move your shoulders a little bit and let me know if you feel any clicking or grinding or catching.
Nope, we're good.
Okay, good. So we're going to start with a test that's called a speeds test. I want you to extend your arm straight out in front of you, and then you're going to supinate, or you're going to turn your hand like you're holding a bowl of soup. And then I want you to take your other arm, put it right on top, and you're going to press down with one arm while resisting with the other. Okay, good. Do you feel any pain there?
Nope.
So that tests for bicipital tendinitis, and if you had inflammation of your biceps tendon, you would feel anterior shoulder pain right here in the bicipital groove. So now let me have you hold your arm out over to the side about 30 degrees, tilt your thumb down, take your other hand, put it on top, and press. Okay, I can't see your hand, so can you get your... There you go. This is called the empty can test or the Job's test. It is a sign for testing the supraspinatus muscle. It's the most common muscle of the rotator cuff to become inflamed or to get torn. So now I want you to scratch your back and then turn around and let me see you scratch your back with the other hand. Can you do that for me? Turn it all the way around so I can see your entire back. Okay, good. So what I want you to do is I want you to hold your hand across your back, take your other hand and put it on top, and I want you to push away with that lower hand while providing a little bit of resistance with that top hand. Let me see you. Okay, good. That's called the Gerber's test, and it is a test of the subscapularis muscle. So we have two more muscles to test, the teres minor and the infraspinatus. And what I want you to do is I want you to bend your arm and hold it right here beside you. And what you're going to do is you're going to grab it across with the other arm, and you're going to try to pull this arm in while trying to push out with this arm. And pull. The next test is called a Yoakum's test, and this is a test for shoulder impingement. And what I want you to do is you're going to take your hand and you're going to put it against your opposite shoulder, and then you're going to take the other hand right here on your elbow, and you're going to try to push that elbow up. Good. And often if the rotator cuff gets inflamed, if there's inflammation of the bursa or the tendons as it comes through the subacromial space, you'll have pain with that maneuver. Now we're going to do a test that is called the painful arc test. So I want you to hold your arm out in front of you and let me just see you raise it straight up. Good. So this checks range of motion, but also any tendinitis, and out to the side and take it up. Good. All right. So now we're finished with the shoulder exam. Let's move on to the low back exam. So this is a test that you are going to need to be sitting in a chair for, but I will need to see your legs. Okay, the first test that we're going to do is going to test for sciatica. That's the big nerve that comes down through your buttock and can cause pain to go down the back of your leg. Can you show me your upper thighs and legs? Good. What I want you to do, we're going to be testing your left leg. I want you to take your left leg and extend it straight out. Good. And then let me see your foot, and I want you to pull your toes back towards you. And now what I want you to do is I want you to tuck your chin to your chest.
Okay.
Very good. You can put your foot down. So this is a maneuver that stretches the sciatic nerve, and if you were to have sciatica, you would have pain going down your buttock, down the back of your leg. So now what I want you to do is there someone there that can hold the iPad for you? I want you to be sitting in the chair slouched. I want you to grab onto the side of the chair, and I want you to pull down on the chair. This is testing for lumbar disc disease. And I want you to extend your neck, look up at the sky, and then flex, let me see, chin to the chest. Okay, very good. So if you were to have disease in the lower back and the lower spine, that would cause significant pain in the low back. And then there's one more test that I want you to do. I want you to spread your feet a little bit, and I want you to slouch down and put your hands flat on the floor. What this does is if you have spinal stenosis, which is narrowing of the spinal canal in your low back, this provides relief of that pressure on the spinal cord. So now we're going to move on to the hip exam. The first thing I want to do is check the range of motion in your hip. So pull the leg up, good, and then bend it, and then put your foot right here in front of your shin. Okay, let me see, just roll it in and then back this way. Let me see. Good, yep, so that's checking range of motion. It looks like you have really good range of motion of your hip. So now I want you to stand up, and I want you to pretend like you're stomped on a cigarette and you're twisting back and forth, and I want you to feel your hip right where you're twisting, and I want you to feel that the ball of your hip joint. And when someone has trochanteric bursitis, they will have point tenderness right there. And when they do this motion, they will be able to tell you that that is exactly where it hurts. Okay, good. There's one more test for hip that really is a low back physical exam maneuver that you can do, but we're going to save that until you're over on the bed, okay? So go ahead and sit back down. And we're going to move on to your knee exam. So the first test that we're going to demonstrate is called the Thessaly test. This is where you're going to stand behind the chair and hold the back of the chair. So stand up, go behind the chair, hold the back of the chair, and then I want you to stand on your knee that we're testing. Stand on the leg of the knee that we're testing. I want you to slightly bend the knee and twist left and right. Okay, so this test is testing your medial and your lateral meniscus in your knee. I can tell by how well you can stand and twist that you do not have a meniscal tear. Okay, go ahead and sit down. Let's look at your knee together. Let's look at the good knee, which is your right knee, and then we're going to test the left knee. Yeah, I can see both your knees. So I want you to feel the outside of that left knee. Yep, right. Do you feel the bony point where the bone sticks out right there on the side? Rub that a little bit. So when someone has iliotibial band syndrome, right there on the side, the very side of the knee is exactly where they're going to be having their pain, and they're going to point right here to where their pain is when they are running or bicycling. Okay, so do you have a chair there where you can straighten your leg and prop your knee up? All right, I want you to take your hand, your foot's a little bit in the way, there we go. And I want you to try to move your kneecap. Just relax that knee and move that kneecap from side to side. Okay, good. So patellofemoral pain syndrome causes an aching that's deep in the knee. And so often pushing down on the knee, pushing straight down on that kneecap can reproduce some of the pain. And you will often feel some crepitus or crackling feeling in the knee when you're rubbing that kneecap. Next, I want you to sort of push that kneecap down. I want you to feel right here, distal to the kneecap, and rub right over there. That is the patella tendon. And when you get a patellar tendinopathy, that's exactly where you'll be sore. There's a bursa, there's a sac of fluid that's right here, and when that fluid is inflamed, you can have swelling, redness, and warmth right there. And then there's one other part of the knee I want you to examine for me, and that's the pes answering bursa. So with your knee, I want you to feel your joint line in your knee, walk down a couple of inches right there in the middle, and just feel right there for that little sac. That can get tender if you have overuse injury, if you're doing a lot more walking or running than you're used to. Great, Kurt, that's good. No tenderness there. We're going to move on to do that one part of the low back exam that I was telling you about, and to do foot and ankle exam, and then we're finished with the musculoskeletal exam. Let's start with examining your ankle for possible fractures. So this is when you roll your ankle when you have a sprain and it's tender and it's swollen. And probably the most important thing about the history is knowing whether or not you were able to walk immediately after the ankle rolled, okay? So I don't have the Ottawa ankle and foot rules memorized. So I'm going to be looking at my screen and telling you where I want you to touch your ankle to tell me if you're tender, okay? So when you roll your foot in, we're going to test the outside of your ankle. So what I want you to do is there's a bone right here on the outside of your ankle. And I want you to feel the back of that bone, the back of that ankle bone. Yep, and I want to know that that's not tender.
Not tender.
Okay, good. So right here, where the arch of your foot comes across laterally, it's at the base of your pinky toe.
Uh-huh.
I want you to feel right there, that little bony protuberance, the little knot that sticks out, and let me know if that is tender. Is that tender at all? Okay, so we're going to go to the inside of the ankle. So when you sprain your ankle the other way, when you've twisted it the other way, I want you to, again, feel that bone that sticks out and sort of feel back behind it. But just the back part, right there. Right there. So trying to feel for tenderness right there. And then the foot right here, this is the forefoot, the midfoot, excuse me. I want you to rub right there on the midfoot to tell me if you have any midfoot pain.
No pain.
So looking right here at my ankle, so here's the bone that sticks out. There's 3 tendons. There's one that goes forward, one that goes down, and one that goes back. And the one that goes forward is the one that's most commonly sprained. So just off that knot, I want you to feel that tendon. Then I want you to come beneath that malleolus, that little outpouching, and feel the one that goes down. And then I want you to come back and feel the one that goes backwards. Okay, thanks for demonstrating that, Kurt. You definitely do not have a foot fracture, so you do not need an x-ray. But there are a couple of more exam findings that we're going to do on the foot real quick, and then I'm going to have you go over and lay down and ask someone to help you, okay?
Okay.
So one finding is you take the foot and you squeeze. So when you're having pain, usually seen in women who wear high heel shoes with a narrow shoebox, they can get what's called a Morton's neuroma. So I want you to show me your foot and squeeze right on the base of the toes. Good. Any pain there?
No pain.
Okay, and when people start running and increasing their exercise, they often get stress fractures at the base of the second or third toe. So what I want you to do is I want you to feel your second toe, and I want you to feel the base of that second toe, that bone, and I want you to just sort of walk your hands down that bone on the top of the foot.
Got it.
And this is checking for a stretch fracture of the second metatarsal head. Okay, good. The last part that I want to do before we go check your Achilles tendon is to check for plantar fasciitis. So often when people have heel pain, The pain will be the bottom of the heel, but you can actually push right here where the plantar fascia inserts into the foot. Put your thumb right there and give it a good deep palpation. And if you have plantar fasciitis, this will be very painful and tender. Okay. We're ready to test your Achilles tendon, and then we'll be finished with the ankle exam and that one exam we're going to do on the lower back.
Okay. So
is there a couch or a bed that you could lay down on and have someone help you with this part of the exam? Okay. So I want you to lay on the bed on your stomach with your feet hanging off the edge.
Okay.
Okay. So when you are flat on your stomach, if you push up to your forearms for me, right there. So when you are having low back pain that refers to the hip, often getting in this position will alleviate the pain in the hip, and then you can tell if the pain is coming from the hip or if it's actually coming from the lower back. So thank you for demonstrating that.
Okay.
Now go ahead and lay back down, and we're going to look at your calf muscles. So I need someone to help me with this part of the exam. I want to look at your feet hanging off the edge of the bed to see if they look symmetric, if they look the same to me. So just having that view will help me assess your Achilles tendon. The feet should look symmetric. They should look the same hanging off the edge of the bed. Okay, they look the same. Now what I want you to do is I want you to squeeze one of his calves while I can still see his foot. Okay, down just a little bit. There you go. Squeeze. Release. And can't quite see his toes. Now, there we go. Now I can see his left foot. Could you squeeze his left calf and squeeze again? And let go. Okay, good. Now let's look at the other foot, and I'm going to have you squeeze the other calf. So the foot should dorsiflex symmetric if the Achilles tendon is intact. Okay, and let go. Yep. I don't suppose I could see both his feet and you could squeeze both his calves at the same time, and it's the last thing I'll ask of you. That's perfect. I can see both his feet perfect right there. So if you could just squeeze both his calves about midway up for me, I want to see that his feet flex evenly. Okay, and let go. All right, perfect. Normal exam, Kurt. No signs of an Achilles tear. That's it. That wraps up our musculoskeletal exam. Kurt, thank you so much.